Let's look at the column headings at the top of the screen. Service is the way orders are grouped on your screen. For example, orders are grouped by code status, nursing, diet, meds, lab, imaging, and consults. Code status indicates if your patient is a full code or do not resuscitate. DNR orders usually will be flagged by unit secretary, and you will see them highlighted by a red box. These require close attention and follow-up by all staff. If your patient does not have a written code status order, like our test patient here, assume he is full code, but follow up with your preceptor. Sometimes DNR orders expire or fall off the system before a provider can renew them. If you are unsure, you can always ask your patient if he is able to tell you, or look at his identification wristband. If the patient is a DNR, it will be written on his wristband. We're going to go through each service now and explain a little bit about each one. The administrative heading denotes items requiring follow-up by unit secretary or clinic scheduler. Here you'll see paperwork that needs to be completed or follow-up appointments that need to be scheduled. Next you'll see ADT, which stands for Admit, Discharge, Transfer. This order tells you what inpatient physician team the patient will be assigned to. Or, like this patient, if the patient is going to be discharging soon or transferring to another team. The section marked Nursing indicates orders pertaining to nursing staff responsibilities. These are standard admitting orders or nursing-specific orders. Typically, you'll see orders here related to fall precautions, vital sign schedules, SCD placement, activity status, CBG testing, telemetry placement, SCD placement, and patient condition, among other things. You'll also see condition-specific orders. For example, patients requiring straight catheterizations or Foley placement, drain management, or one-time specific orders like obtaining an orthostatic blood pressure. The next section is diet. This section includes the diet ordered and any dietary recommendations or preferences, fluid restriction, or tube feeding and nutritional tube management for your patient. Pay attention to this section here, as providers often change diet orders frequently throughout the day, especially for those patients on tube feedings, those scheduled for surgery, aspiration risks, or are seen frequently by a dietitian for nutritional recommendations. The next section we would see is inpatient medications. This section shows all current active medications your patient should be receiving on a scheduled or as-needed basis. One time, also referred to as now or stat medication orders, also show up here, so it's important to check this section often for new meds or changes to medications. Unfortunately, our test patient does not have any current active medications ordered. If she did, we can double-click on any of those medications to bring up a box with information about when the medication is scheduled, who ordered the med, who verified the med, and a history of when, how much, and who has given this medication to the patient. Anytime you are giving one-time or as-needed medications, please utilize this feature. It's important to know when the patient last received this medication, as giving a medication too early or too late can cause adverse reactions. Now, you also may see a respiratory care order in the next section. You'll typically see this section for patients who require a CPAP. Respiratory therapy will need this order to set up a CPAP on your patient. This test patient doesn't have a respiratory care section. The next section will be labs. This section shows all ordered labs for your patient. Please note the start, stop, and times and status columns of the lab section. Many times, outpatient providers will order labs here to be collected at a distant date. Typically, we are not concerned about these in the inpatient setting, so we'll want to make sure the start and the stop date or collection time is accurate during the admission period. Looking at the status column will tell you if the lab was collected and sent to the main lab for result generation, or pending and still needs to be collected. Active means the lab has been collected and verified by a lab staff member, but a result has not yet been generated in the system. Complete means the lab has been collected and a result has been entered in the system. Pending means that this lab has not yet been collected by an IV team or nursing member of the team. All completed status labs will drop off the system within several hours. I also want you to note the letters LC or WC next to the name of the lab that has been ordered. LC means lab collect. This means that this lab has been ordered as a part of a scheduled bulk draw, and a member of the IV team will be coming at a scheduled time to draw this lab on your patient. When you see WC, that means ward collect. This is a lab that is not scheduled as part of a bulk draw. The unit secretary, your preceptor, or you must alert the IV team that a lab draw is needed on this patient. Typically, labs that are ordered as WC are stat, now, or one-time labs that the provider requires a result more quickly than waiting for a scheduled bulk draw collect time. The next section in the service heading is imaging. This section shows all ordered imaging procedures, including X-ray, CT scan, MRI, and Doppler flow studies, ultrasounds, or any other procedures that require a picture and interpretation by radiology. Note the start-stop column and the status column here as well. If the test is labeled as pending in the status column, then the imaging procedure has not been completed and may require some follow-up by you or your preceptor. A status of active means the imaging procedure was completed, and we can find the results in the Reports tab, which we'll talk about later. You can double-click on any ordered imaging procedure for information about why it was ordered. The last section is consults. These are requests placed from one clinical specialty to another. Typically, you'll see consults for nutrition, physical or occupational therapy, social work, wound care, diabetes education, prosthetics, or a medical specialty service. Nurses can place certain consults like nutrition, social work, wound care, or PAVE, for example. You can talk to your preceptor or instructor more about that. Again, you can double-click on any of the ordering consults to find out more information about why it was ordered and by whom. We'll review consults again in the Consults tab later in this video.